Hi everyone, myself Dr. Sumalatha, working as reader in the Department of Oral Medicine and Radiology, Babu Banarasidas College of Dental Sciences, BBD University, Lucknow. Today, I will be discussing on prescription writing. To introduce with the topic, prescription is the written order of a registered medical practitioner for one or more medicines together with the direction to the pharmacist for their preparation and to the patient for their use. Why you want to know the importance of prescription is it provides an important means of communication between the doctor and the patient and the follow-up. It's a legal documentation, record source, and trial for medical therapy. Coming to the types of prescription, there are mainly two types of prescription: pre-compounded prescription. Second one is compounded prescription. Pre-compounded prescription means the prescription for already prepared drug by a pharmaceutical companies. For example, like capsule ciprofloxacin 500 mg. So second is compounded prescription, also known as extemporaneous prescription. The pharmacist will prepare the medication according to the drugs and doses directed by the physician. Coming to the parts of prescription, an ideal prescription should have the following parts. The first and foremost on the left side is the doctor's name and the qualification. And the same on the right side, you should have the address, that is the clinic or residential address, and the contact number of the doctor. The second important is date, and the third is patient's details like patient name, age, gender, and address of the patient. The fourth is superscription, which is denoted by RX, which is an abbreviation of a Latin word receipt, also known as take, though, or you take, please, and order to the pharmacist or dispenser for preparing the medicine. RX may derive from the Egyptian Eye of Horus symbol denoting health, or may be symbolic appeal by a physician to the god Jupiter. It's nothing but god of knowledge, learning, and healing for the success of the prescription. The RX is the symbol for superscription, which is always right just before you write any medications. On most prescription forms, the denote RX is already printed. Write the inscription information immediately after this symbol. The inscription includes all the information about the specific drug that you want to prescribe. The fifth category is inscription, which is the body of the prescription consisting of the official names and the amounts of the drug. The drug may have four components. One is basis, the second is adjuvant, third corrective, and fourth is solvent or vehicle. Basis means it's a chief ingredient of the drug. The second, adjuvant, means any secondary active drugs to assist the action of the basis. The third component is corrigents or corrective to correct undesirable quality or action of the basis. The fourth component under description is solvent. It's also known as vehicle, which give us a suitable form of administration. Coming to writing the medication, you should typically use the generic non-proprietary name of the drug instead of the brand name. Use of the brand name of the drug only when you specifically wish to prescribe the name of the brand. Keep in mind that doing so, you may take the prescription more expensive for the patient. The next component and the parts of prescription is subscription. Subscription will provide the direction to the pharmacist or dispenser. The seventh is transcription, signa or signature. It's a direction to the patient, contains instruction about the amount of drug, time of taking drug, and the frequency of the doses to be taken. And at the end, there should be a signature. The prescription should always signed by a prescriber or the doctor who is prescribing the medication. So This slide showing the example of extemporaneous prescription. So as I already told, first and foremost, it should be the doctor's name along with this registration number and the doctor's address, the contact number, which is followed by the patient details like name of the patient, age, gender and address, and the contact number of the patient, which is followed by the symbol RX. Below that, we have to mention the medications which you are prescribing. Then at the end of the prescription, you should be on the left side, there should be a date of prescription. On the right side, they should be followed by the signature of the doctor. The second slide showing the example of a pre-compounded prescription. So here it's also same format. Only thing is here we'll just write the main brand name of the drug instead of generic name. We won't write the details of the drug in pre-compounded prescription. So these are the some abbreviation of the prescription, how they should take. For example, like BD means they have to take twice a day. TDS means 3 times per day. SOS is as necessary or if necessary. OD means every day or once daily. And AC means before food. PC means after food. And ON is means every night the patient should take. QS is a sufficient quantity of the drug should be taken. HS means at bedtime. So these are the few abbreviations. Then coming to how to write the prescription, the part 1 is the basic information. Part 2 is inscription. Part 3 is subscription. Part 4 is the patient use direction. Coming to the part 1, which includes 2 patient identifiers. The full name and date of birth are the two most common identifiers. For prescription fulfilled outside of a hospital, the patient phone number and the current home address as usually be included as well. One identifier isn't enough even if you use the patient's full name. If 2 patients say the same name, it would be impossible to know which one the prescription refers to without any other identifier. It will provide your information as the prescriber. Your name and contact number should be listed in the prescription, which include full address of the doctor, name and the phone number. Second is note the date of the prescription. Some prescription must be filed without a certain time period. Even when the medication is being prescribed does not fall into this category, you should still include the date. Then sign the prescription. You will need to sign each prescription before it is considered to be valid. It is strongly recommended that you write out the rest of the prescription and sign your name at the last. Doing so, it prevents unfinished or blank prescription from falling into the wrong hands. Second part is the inscription, which is displayed by a symbol RX. It should be right just before the RX symbol, the medication should be written. Most of the prescription, this symbol is already in the printed form. Write the inscription information immediately after this symbol. This inscription includes all the information about the specific drug that you want to prescribe. Then write the medication. You should always use the generic non-proprietary name of the drug instead of brand name. Only we can use the brand name when we want to specifically prescribe certain brands of the drug only, as it can be more expensive for the patient. If you want to prescribe the name brand, you should also include a note on the prescription reading no generics. Then mention the strength of the medication. Most medication comes in multiple strength, so we should mention the strength according to the wish to prescribe immediately after the name of the medication. The strength can be indicated in milligrams for tablets and suppositories and milliliters for fluids. Write words instead of abbreviation to avoid possible misunderstanding. Then include the prescription amount. Tell the pharmacist exactly how much medication should be filled and passed to the patient. This information should be preceded by an appropriate heading such as dispense or how much. Include the specific bottle size or the number of tablets or capsules, and spell the number out to avoid possible miscommunication. Note the number of permitted refills for medication that treat the chronic conditions or other similar reasons. You may wish to permit a certain number of refills before another prescription will be required. So only allow additional refills when the patient is need to take exact same prescriptions multiple times. Then patient use directions. You should always mention the specific route through which the patient has to take the medication. So when writing the route up, you should mention the instructions using either accepted in English term or corresponding Latin abbreviation. Then state the dosage amount, how much the medication the patient should use each time he or she takes it. These instructions should be transferred to the prescription label once it is fulfilled. For instance, you might write something like 130 milligram tablet or 30 milliliters. Then indicate the frequency of the medication, how much and how frequently he has to take the medication. It is strongly recommended that you write out the frequency in full rather than using abbreviation, like whether he has to use daily or every other day or twice daily or thrice daily, like that. So write when to discontinue use. When medications are taken until the drugs run out, in some cases, the patient should stop taking the medication once his or her symptoms will disappear. So you should specifically write in that case how many days he has to and when he has to stop the medication on the prescription. And always consider the diagnosis in the prescription. When medication should only be used as a needed basis, you should include a brief diagnosis or the reason why he is taking the medication. And always write the full form of the diagnosis instead of abbreviation. And mention any other special instructions that needs to be taken by the patient while taking the medication. So for example, like take with food, avoid alcohol, keep the medication refrigerated, do not freeze. And for ointments, you should mention that for external use only. And for syrups, they should instruct that shake well before the use of the medication. Warnings. To reduce the risk of tampering or miscommunication, write prescription in ink or indelible pencil. They may be also typewritten. Make sure that all prescriptions are written clearly and legibly to avoid errors in dosage. Some errors can be deadly, so it's crucial that you do not who can prevent them. So only write prescription if you are authorized to do so. To conclude, a prescription written precisely and completely finalizes the plan for improvement of the health and welfare of your patient's eyes. Learning the system for writing prescription requires actually writing them and reviewing the above guidelines to be sure the instruction and format are correct. Points to remember is keep good records of medications prescribed, dates written, length of the treatment, concentration of the medication, and your diagnosis of the condition. Explain specifically to the patient how to use the medication, why it should be used. When possible, explain the dosage, diagnosis, and the reason for the treatment to be available and the caregiver of the patient. It may be his husband, parent, child, nurse, etc. Give written instruction to the patient in the office when the dose schedule is complicated, when multiple medications are prescribed and tapering up the dose is needed. Written instructions are especially important to achieve the compliance. If you suspect the patient can't read or he may not be able to understand the written instruction, check for understanding by having the patient repeated instruction verbally after you explain how to use the medication. And if possible, explain the dosage and treatment plan to a family member. Thank you for your patience hearing.